hello everybody. Thanks for having me here. I appreciate the Pulse team for bringing me out and to talk about what's going on in the marketplace. We're all kind of stuck in the day-to-day trying to make sure that the transformation of healthcare from an industry into a system occurs, which is an awesome thing to be watching, so to speak. It's a little bit challenging on a day-to-day perspective to make it happen. But what I was asked to talk about is, what's going on in the private and public sector, and what are they doing to actually drive innovation and technology in the marketplace? The market had been left alone for quite a while, but we all have a sense of the why now, so I'll do a very quick overview of the why now. And by the way, feel free to interrupt as we're going through this if there's any specific questions you have. But the reality is, if you think about the healthcare as a marketplace, there's really a very difficult time we have kind of placing value on and understanding it, and there's a lot of reasons for that, right? And if you took out the nature of the fact that these are countries as dots, and if it was actually companies, and you think of that curve as kind of the value curve for whatever the marketplace is of any normal good, any company that would be that far away from the value curve probably wouldn't exist very long, right? When you think about it. The reality is, unfortunately, that's where the US is today. So, and there's a lot of different y-axis dimensions you could take a look at. Life expectancy is one. There's other rankings in terms of quality of care delivery, et cetera. But the reality is we're roughly about 2 times the cost of the rest of developed nations, and quite a bit more than developing nations in terms of cost per capita spent. And the health output in this case is measured by life expectancy. As you can see, we're quite a bit behind some of the other countries that are listed here. So really, it's really an issue of shifting from a fee-for-service model towards value, and all the things we were talking about earlier around how the digitization of life and now finally the digitization of health is occurring is going to help us understand and unlock and define that value definition. So how did we get here? We were actually doing pretty well about 30 years ago, right? We were right in there with the pack in terms of average spend per capita. But unfortunately, in the last few decades, since we had some very, what I would call unsophisticated buyers of healthcare, they've allowed the cost to increase dramatically. And in some peak periods, you're talking about 8 times the versus the income that a person is generating on an annual basis. So whenever a good goes up by that much times your income, you're going to see some disparities. And the way that reimbursement occurs in the marketplace makes this very challenging for people to actually see how it's happening. So we had a series of government and employers predominantly paying the vast share of health spending, and they allowed the cost to move up. And we've finally gotten to what we call an inflection point, so to speak, because it's not expected to change. I'm sure you've seen lots of studies that talk about this in nauseating detail. I happen to pick out more of a focus on the public sector, because as we know, it seems to be shifting more and more, especially with the demographics, focusing on where the boomers are going to be going and the higher costs that an older population brings with it necessarily, where it's not sustainable as it is right now. So things that usually in nature can't persist usually don't. So currently, on the track we're on, we know we need a transformation, but we're talking about basically a healthcare nation that we're transforming. And there's a whole range of different stats you can look at, but if you think about it, basically we're talking about a $2.6 trillion industry, which in and of itself makes it the 5th largest nation in the world. So it's kind of like a mind experiment, right? If you were to say, well, France is broken, which is roughly the size of that country, and you walked up and said, well, we're going to change everybody's job, roles, technology, and redesign how France does its business as a country, that'd be a pretty daunting task. So if you feel like you have a pretty daunting task ahead of you to redesign and re-engineer healthcare, you should feel that way. This is something that hasn't been done on this scale ever, so to speak. The other thing to keep in mind is, of course, there's the status quo issue. $2.6 trillion is a cost, but it's also a huge amount of revenue, right? It supports a huge number of jobs, companies, profitability, et cetera. So when you, in the course of human history, typically when you're doing well, you tend not to want to give up doing well as a company in order to transform yourself. It's very hard to self-inflict. And when you think about it from an innovation perspective, most industries that have been digitized and been transformed, typically it doesn't happen from within. Some great examples you all know of, the music industry. No one in the record publishing industry came up with the iTunes store. And by the way, we all love that innovation. We love the disruption it caused, because now suddenly we were able to get access to music how we wanted it, when we wanted it, in a very intuitive fashion. But that came from outside, and it's time and time again you see that happening over and over. So where are we heading? So we're in the process of this transformation. I actually think of it as a healthcare renaissance. I try to put a more positive spin than a reform. But the reality is, because of the emerging technologies and the fact that we're at this precipice where we really just can't afford to spend much more of our income on healthcare and continue to get low value, And we're shifting towards what I think of as a healthcare system. And I think of it as a healthcare system 2.0, because where we're at now is what I think of as a 1.0. So it's really shifting toward this kind of activated and informed patient caregiver model that's going to be in tight partnership with the prepared and proactive care team. Sounds great. The big difference that's happening now is there's all these emerging technologies that are going to make that possible, right, and actually bring value to the equation. Much like we've seen productivity-wise improvements in other industries, that's when they became digitized. This is the only industry that we know of right now where technology actually makes it less efficient to deliver healthcare. Every other industry, productivity improvements happen all the time, right? Auto industry, every industry, tech industry. I mean, the perfect example, everybody has their phones, their iPads, et cetera. If this went up in cost every year and the features were the same or slightly better, you would say, what's wrong? It's broken. Obviously, I'm not happy with that. But healthcare, that's not the case. So the emerging technologies are going to enable this healthcare system 2.0 to rise this time. It's taken a little longer for all of the reasons we've been talking about. What's interesting around this, in order to make this happen at that core, to make that core effective, is all of the current players, and by the way, I use the current terminology for the current players because they're in the process of re-engineering themselves, right? So we don't know what these players actually will be calling themselves in the future, but it's pretty obvious that many of them are starting to head into each other's spaces. They're starting to deliver services much more broadly. So currently you see a whole series of insurers getting into the health technology space, providing services that are very different than what they have in the past. You see hospital systems, you saw UPMC as an example, being very aggressive in driving innovation and trying to transform their business models, Kaiser Permanente and others moving in that space. A whole series of organizations who are in the process of trying to deliver a point-to-point series of services that are fully integrated that actually enable that activated and informed patient and caregiver to be all that they can be, but also the provider network to be all it can be. So it's a fascinating transformation to watch happen. And given the nature of how the U.S. is, we're not going to do it all consistently. It's most likely going to happen geographically. Right, wherever the political will and the leadership's in place at a local level, this is going to be happening in kind of think of it as a quilt that's being built, right? And it's going to happen very ununiformly across the country. So that's kind of the backdrop. So what is the public and private sector doing to drive health technology innovation? Some of this you may know about, some you may not. But the key players, the government has jumped big time into driving business model innovation. As you saw from the earlier graph, they have a lot to lose, basically insolvency. Or much greater taxes that they have to raise to pay all that Medicare and increased Medicaid costs that they're projecting. So it's unprecedented, right? I think of it as kind of almost a government 2.0 merging with a health 2.0, so to speak, approach to doing this. The government's heavily getting involved in changing its approach to how aggressively they're going to drive technology and innovation into healthcare. HHS, CMS, ONC, et cetera, all these different organizations are doing all types of different activities to try to be the convener and instigator of the change because the system wasn't changing itself fast enough. Foundations, they're again jumping deeply into this. Robert Wood Johnson, California Healthcare Institute, Qualcomm Life, et cetera. You see them popping up, and they're all investing heavily in trying to drive these emerging technologies and trying to have them bring productivity and value back into the system that right now doesn't understand how to evaluate it. Accelerators and incubators, kind of an older idea that in the normal non-healthcare IT space. There have been some very specific accelerators and incubators of late that have been growing up that are private and public sector focused, that are focused on health technology. I'm sure many of you know health technology is a huge boom sector. We're looking at massive growth because we're expecting that health technology will fuel the value equation and the transformation we've referred to earlier. So that's an interesting development of late. And tremendous amount of corporate ventures. Some of you, I'm sure, live in organizations that do this, but right down the line, right, from insurers down to providers, hardware companies, network companies, life sciences companies, and all the others that are out there. They're all setting up these very, very substantial organizations internally to evaluate what are the emerging technology trends that we need to be investing in, taking a look at. Who do we partner with and collaborate with to leverage those across the continuum so we can drive value into the equation. And everyone's bringing their own spin on it, of course. So it's fascinating to watch this progress so rapidly. But if you think back, 3, 4, 5 years ago, a lot of this stuff wasn't in place with nowhere near the amount of significance it has in the market today. So there's big bets being placed on the table, and everybody wants to be a major player or remain a player in that graphic we showed earlier, of course. So what are the methods that those players or bringing to bear against the marketplace. There are, of course, the actual accelerators and incubators that are existing today, and there's several others that are in the process of being launched in the marketplace. And we'll talk about how they work in a little bit. Pilots and alliances, you see a ton of piloting going on, right? Because this is the undiscovered country, so to speak, in terms of what healthcare needs to look like. So not many people are going to be able to commit, since healthcare is a risk-averse industry. Not many companies are going to go full scale with a new concept and approach. After all, most of this is for profit, and they can't really go at risk to the degree they necessarily may need to from a time perspective. So there's a lot of piloting going on, test cases, and they're driving this in terms of alliances across some very interesting, what you would call bedfellows from before. So quite a few collaborations of organizations you typically wouldn't have seen in the past getting together, which is good for the market. Grants, you see substantial amounts of grants activity in this space, health technology space in particular. CMS, as an example, with their innovation effort, they're going to throw $10 billion at reinventing and redesigning how healthcare gets delivered around the country. Many of you know they have a rolling grant process that they're going to be issuing into the market, and it's creating some really interesting collaborations and provider network engagement strategy opportunities. Challenges being issued. This is kind of channeling Todd Park when you think about it in terms of all the excitement that he generates in a room around the government's role in terms of issuing challenges. In particular, the ONC has gone out and partnered with a company called Health 2.0 to issue and manage these challenges on their behalf. And they're doing quite a bit of interesting stirring of the pot. Shortly after that, you saw quite a few challenges being issued by foundations as well as private sector organizations who are also interested in driving challenges. And Americans love to rise to challenges, so there's some interesting opportunities to jump into this space and make a mark for yourself in the health IT space. And then, of course, crowdfunding. Crowdfunding's been around for a while. It's starting to raise its head in the health technology space. Not as popular, but still there as an option. Any questions yet? Great. How do these methods work? So the accelerator is pretty straightforward. The reality is you have a few people who typically are investors, and they provide some seed capital and some operational capital for the actual incubator itself. They also typically get involved as part of the mentor network for those accelerators and incubators. Interestingly, quite a few of the mentors, by the way, are not investors. So if you go out and research any of the companies I mentioned earlier, you'll note that there's a wide range of mentors. Not all of them are necessarily investors. But typically what they provide, the actual accelerator itself, is they provide education. So the education varies quite a bit depending on where the individual is in their life cycle of developing companies and knowing how to start up a health technology company. But it ranges. So it could be quite a bit of one-on-one mentor individuals sitting down and having some coaching and counseling. It could be they bring in someone who does kind of a general audience discussion to everybody who's in that class who gets accepted into it. It could be a series of mock demo days and presentations that they go through in terms of what to do and how to do it. So there's quite a bit of education that they provide and support. The other interesting factor of this is they create this single site boot camp for health technologists. So they throw these interesting, diverse companies together, and they work day to day in what you think of as a bullpen. And you have a space, sometimes quite a bit smaller than this, where you throw half a dozen to a dozen companies in, and they work with each other. And it's great to watch them create opportunities to synergize and actually work together and bounce ideas off of each other. It's as much about the camaraderie that they're building opportunities to kind of create a mini Medici effect as it is to engage with the mentors in many ways. Of course, they all get prepared and excited for what they think of as demo day. That's the big day when they have their coming out party and they have an opportunity to, having spent all the time building and presenting, doing their mock presentations to the mentors and others, they prepare for the demo day to the venture community as well as potential buyers of their solutions. Actually, as an example, tomorrow the demo day is set for Blueprint Health, which I happen to be a mentor of as an example. So tomorrow is the big event for the current class of Blueprint Health. They'll be doing their demo day in front of many people, and they've been working diligently over the last few weeks, making sure that they're ready for that discussion. And the other support these incubators and accelerators provide is really around the whole concept of business development and scaling. Right? Because typically you'll find a lot of people who are either first or only or second time through doing something. And what you'll find also is quite a few people who come in and don't know healthcare. They know technology or they know some specific thing that they want to bring into healthcare. And as people who all understand healthcare is not a normal marketplace in many ways. It's very hard to go direct to consumer. So B2C is very challenging, and many have tried and many have failed. Some have succeeded, but many have failed. There's a very interesting B2B model that has to be understood. The regulatory environment is more challenging. So there's quite a bit of scaling support and business development support that happens within the safety and sanctity of the accelerators and incubators that have been developed. Before I go to the next, any questions on accelerators? No? Great. Pilots and alliances. So there's a lot of this going on. Interestingly, it's handled in many different ways. Sometimes it comes out of business development teams. Sometimes there's actually innovation teams. I put innovation in quotes because not everyone calls it that. But in reality, it's people who work full-time internally who are in the process of scouting out opportunities to do different alliances and pilots with either tech companies directly and or other potential collaborators for scaling purposes. So there are teams up and running. They engage with emerging health IT companies in many ways. They search for them in different ways. They attend conferences. They do screening processes. They run challenges, lots of different approaches, but they're always in the process of doing that continuous search. The partner side's interesting, right? Because there's quite a different set of ways to go after from a partner perspective. I find it very reassuring that I'm finding these organizations much more open than ever to collaborating with other what you would normally term as competitors. They're starting to realize that healthcare is quite a different good. It's not a normal good. So you're finding insurance companies working together, for instance, to drive health at a local community level. You find hospitals, in some cases, working together to make that happen. Very, very interesting that they're that open to, partnering with potentially what has been competitors in the past when they would never have gotten together. So that's exciting that this is all being driven through these alliance and innovation teams. What's interesting too is that in the past, we've, as many of you know, if you've been in healthcare for a while, many of the times we've done these pilots, it was all in the spirit of research. So the goal was really to write an academic paper, to talk about it and discuss it generally. Most of those things weren't really measured or potentially scalable. That's another huge transformation around healthcare. Huge focus on results, value, scalability. Those are things that typically tons of grant money be thrown at projects and engagements and pilots, but what happened to those? If we go back through our history prior to the last 5 years and take a look at all the pilots and innovation that was developed, how much of that was actually scaled and showed value and increased productivity and outcomes? I don't know the percentage, but I'd love to have someone kind of do some type of a meta-analysis. My guess is not very much. Even some of the more monumental things like Framingham, et cetera, were very well publicized. How much of that actually scaled? It ends up being much more just for the purpose of doing academic research. And that's not where we are now. Healthcare is past the academics. This is now about developing real solutions that are scalable and can be pushed into the market in an efficient and fast fashion. We're out of time, as you saw earlier. The scaling piece is, again, very interesting because, once again, you're seeing some interesting, not just in the piloting, but on the scaling side, they actually are working, again, with these very diverse networks and partners. And interestingly, health technology companies quite often make this happen because they're kind of the safe place where diverse collaborations and scaling opportunities could occur, all in the spirit, essentially, of driving better value to the market. So this is another one of those areas where you're seeing a hotbed of activity, right, these pilots and alliances. The grant side of it, again, I mentioned a few minutes ago, typically a lot of the research we've done, so grants have been around for a while, obviously. I think the flavor and nature of them and sense of urgency around them has changed fairly dramatically. Just a case in point, as an example, you think of the CMS Innovation Group. They now have $10 billion to go off and basically create pilots to re-engineer how healthcare gets delivered. I don't recall that happening in my lifetime anyway, in the US or anywhere, frankly, on that kind of scale. $10 billion to figure out how to transform. Many think it's potentially too much money. When you're talking about $2.5 trillion industry, if we were redesigning what France is, would $10 billion be enough? Not so sure. That being said, that's just one bucket of money. There's a whole bunch of other buckets of money in terms of trying to redesign how healthcare gets delivered. But in standard fashion, the RFPs get issued. Typically what happens is these diverse collaborative organizations or people who are more willing to collaborate get together and create a team around the concept, and they'll try to figure out what that solution looks like with that diverse team. And it's not about creating a paper, right? It's about creating a solution that's scalable. So the discussions and the quality of the grants that are the grant responses that are being submitted are very different. They're expecting measurement. They're expecting a plan for, okay, if this works, then what? Which is very different flavor that you get to the grants. So it's kind of not your parents' grants. It's new generation of grants, like grants 2.0 model is emerging, which is exciting because you're seeing people who typically are just used to getting a bucket of money to fund something to actually do something practical that can be scaled. And you'll see that, they'll launch these programs, and I need to emphasize the whole measurement piece of this because that's critical now. Once again, we're trying to make sure we measure results. It's not just about being able to do it. It's making sure you did it and it had an impact. And if it doesn't work, that's great. How do we rapidly, under the concepts of innovation, it's all about rapid redesign. When something doesn't work, you come out with a version that does. Software companies are very used to this, right? Think about how quickly we've gotten used to a constant software update now that it's all virtual, right? We don't have to buy a new software. It just kind of gets downloaded with the latest patches and fixes and bug fixes. And that model is starting to evolve into into the healthcare space, which is wonderful. The challenge side. What's interesting about this, of course, is challenges have been around for a while. What's exciting about it is to the degree to which it's being focused on healthcare and driving value. A lot of different organizations jumping into this space. As I mentioned a few minutes earlier, ONC specifically has brought on board a company, Health 2.0, to do this. So they have a whole series of challenges they're running on behalf of the government, and they're in the process of creating those challenges and working with and partnering with organizations to support getting those challenges out there. So that makes it exciting. You have multi-stakeholder challenges being issued now. So it's not about just how do you fix one person's specific problem always. It's typically a little broader. They're trending towards addressing this from a much more patient-centered perspective, which is great. And you're also seeing challenges that are issued by the private sector, who are in the process of also being involved in stoking the fires of innovation in the marketplace. So challenges are quite an exciting space to watch, and typically how they work. Interestingly enough, there'll be some sponsor, of course, who wants to do this. And if you're interested, by the way, companies like Health 2.0 are good places to stay tuned to, because they have like a whole challenge section on their website. If you want to keep track of that, there's other places to go, but they're an interesting partner to potentially approach if you're interested in responding. They always have some challenge open for response, and they're always in the process of coming up with new ones, so stay tuned to that channel. So what's interesting about it, of course, is these challenges are very diverse in terms of what you see. Sometimes they're very small in scale in terms of what they're trying to address. Again, it depends on the sponsor and what they're trying to accomplish. Sometimes they're very large. Let's address childhood obesity kind of challenges. So you have a huge range of creativity in terms of how your response gets structured and who your partners are depending on what you're trying to accomplish, which is great. What's interesting with the challenge process, if you're selected through the initial toll gate, you get involved and in front of typically creating some form of prototype if you move into the finalist stage, you develop a prototype, and then you have your version of a demo day. What's interesting about the demo day when it comes to a challenge, typically these challenges have an interesting and diverse set of judges who will come in and actually do this. I was involved in one challenge in particular where we actually had a judge from every stakeholder type in healthcare. So you had someone who represented consumers, providers, payers, the government, health technology, et cetera. So really interesting when you think about it, especially if you're going to have an opportunity to present to a diverse audience, to make sure that solution addresses multi-stakeholders, which typically if solutions are going to work and be scalable, they have to address more than one or two stakeholders, because healthcare is so interwoven. So that makes it exciting. So the judging is an interesting process when it comes to these challenges. Demo day is exciting and harrowing for the people who do this. Obviously, they spend all their time trying to get in here. And then, of course, the opportunity then to kind of do that pilot. Typically, the winner gets involved with whoever the sponsors are to actually create some form of a pilot to show that it's not just an academic paper. Is it something that we can scale? Who do we pilot with to show specific results? And the other opportunities then to identify opportunities of scale specifically emerge from these challenges. Because once again, the sponsor, typically if they're going to put money on the table, and it's not cheap to run a challenge, right? They typically would like to see the solution scale to some degree. Because again, we're shifting from this mindset of doing research for research's sake in healthcare, but actually trying to have it be something that impacts value in the marketplace. Crowdfunding. So crowdfunding is interesting because it's software that exists in the marketplace. There's some uncertainties around exactly how the financial flows of this work, because it varies by state, so you've got to find the right partners to do this with. But interestingly, right, the software exists that allows the crowd to vote with their money. in terms of what's interesting or exciting. So there are some health technology companies. Typically it's been done for art, the arts, movies, some software solutions, et cetera. But traditionally hadn't been many in the healthcare space. You're starting to see this be used by some startup health technology companies to have people vote from the crowd, so to speak, and the crowd will submit funds. Sometimes, by the way, they're structured as investments. Sometimes they're structured as donations. So depending on the nature of what type of crowdfunding you're looking for, funding could be an investment or it could be a donation. So that affects the nature, obviously, of what happens after that. If it's a donation, not likely you're going to have anybody ask you about ROIs because it's just an idea you'd like to see developed if you're throwing money into it. Think of it as a grant, so to speak. If it's an investment, then you have people who are very interested and have a stake, a piece of equity, so to speak, and are very interested in making sure the company works. So there's a whole series of solutions out there that exist in the marketplace. There are none that I'm aware of that are specifically focused on healthcare, so you'd have to kind of go through the 13 plus that exist out in the market and see which ones may be in the right audience. Actually, maybe that's an opportunity to create crowdfunding for health IT. Haven't seen that happen in the market yet specifically. But that's an interesting kind of alternative method for people who are looking for funding to drive these innovations. So that's where I'm at in terms of, that's it for now. I was going to open it up, and I know I kind of covered a lot, but I'd be happy to take questions and answers around any one of those specific areas and in terms of how the private and public sector are in the process of driving innovation into healthcare.
My name is Leon Bars, and I'm from the Massachusetts Medical Society. Covered a lot of ground there.
Yes, sorry.
You know,
I noticed my time was a little short, and I wanted to leave a few minutes at the end.
There's a lot of focus, especially in the last year, 6 months, on innovation.
Yes.
And attending a lot of conferences on this, I notice, and for pretty obvious reasons, the entrepreneurial companies, the companies starting out, are focusing on large institutions because that's where the money is.
That's what they say about fishing too.
Right. So, you know, if you balance that against the fact that 65% of practice, of healthcare is provided in practices of less than 3, you know, you have these retail physicians out there on the front line providing the healthcare who are already overwhelmed just by meaningful use and ACO and all the other, you know, government funded initiatives that are out there. They're trying to stay in line with regulatory requirements, et cetera, and avoid penalties. You know, how do we loop them into some of this innovative stuff without, they're already overwhelmed, they're just trying to keep their practices running. A lot of the ideas are really terrific, but they're really focused on the inpatient experience as far as I can see at this point.
It's a huge challenge. Clearly the smaller practices aren't structured to manage healthcare as it's currently being designed to work efficiently, and as far as I can tell, there's no simple software fix to address this, to take all that administrative stuff of driving innovation into your own practice. I can tell you I've seen some amazing things done by when I go to these innovation summits and they get up there and talk about, they always bring out the case studies of these small practitioners who've done amazing things. And the reality is it all comes down to leadership, right? You can do this stuff, but it takes time. And if you're a small practitioner, there's not a lot of time to give to drive innovation into your individual practices. I mean, you're seeing it in the system at large in terms of how it's reacting to this need to drive innovation into the model because a lot of them are selling their practices. And same thing with smaller hospitals, they're merging because the reality is not many are going to be able to deal with driving innovation. At a minimum trickle down, I hold out hope for as the system becomes smarter about managing itself and its own resources and collaboration is driven through funding realignment, right? Because right now our incentives aren't aligned, fee for service versus quality. As you do that, you're going to see some version of ACS, right? Accountable Care Organizations moving into the market, whatever acronym ends up being the right one, right? Because ACOs are one flavor of the day. It's getting a lot of press, but they're going to have to be involved and part of the team, right? You can't have people doing something that's completely off the ranch, so to speak, and not aligned. And these collaborations are going to drive a chunk of that. So I think it's going to happen whether they sell their practices or not. So I think a lot of organizations are looking to do the right partnerships and looking for the systems that do have the capabilities and the staff to drive innovation to support them, so to speak, in that transformation process. But I mean, you guys know, these small practices don't have staff to do this stuff. They don't have a health technology person on staff. Other questions, thoughts? Did forget to mention one challenge in particular that's particularly exciting is the X Prize. I don't know if you guys seen the latest one that they issued. So the X Prize has been out for a while. You probably have heard of it. They do space stuff and all these cool big prizes. They just issued a $10 million prize for the company who can develop the tricorder. For those of us who remember Star Trek, they're actually trying to build one of those. And whoever wins gets a $10 million prize to bring it to market. So that's going to foster a lot of competition to win that prize.